Thank you very much. Have some nice day, everyone. Keeping well, and this winter. Thank you very much for coming in this cold evening. Saturday, I think we have a big start. First of all, can I welcome Steve to the Airlines to introduce the panels and this industry.
Thank you. Thank you, sir. You've just promoted me. I'm not the CEO of NCA, but I am the Chief Officer for Rochdale Care Organisation that covers Rochdale Infirmary and all of the community health services in the town. So I just want to start by saying thanks to Sahel for asking me to come back and open the event today. This is the second event. The first one was just before Christmas on diabetes. Today's event's all about keeping well in winter, so looking at winter illnesses, and I'll introduce some speakers in a minute. I just wanted to firstly say thank you for coming out tonight. It's really treacherous out there, and it's very, very cold. So thank you for taking the time to get dressed up warm and come over to the community centre. Really, really appreciate it. A couple of things different from the last time when we met. You'll see the camera, we're being videoed, and I believe this is going to go on YouTube for people to watch at a later date. So that's fabulous that we can get the messages out today to a much wider audience. So thank you for putting the effort in and arranging all this, and to the chap there that's managing the camera. Brilliant. Okay. One of the roles I've got is Chief Officer for what's something called the Local Care Organisation. Now that is an organisation that brings together all of the health and care providers across the borough of Rochdale. So that includes primary care, so your GPs, mental health services, so Pennine care staff, local authority staff, so social workers, alongside hospital doctors and community staff, with our community and voluntary sector as well. And one of the key aims that we have is to look at health promotion and health protection. How do we work with communities to look at how to make better decisions, how to have a more healthy lifestyle, and you know, trying to invest really upstream in keeping people well and healthy. And part of today's discussion, hopefully in presentation, is going to cover some of that. The other thing that we're really keen to do is get into communities, to speak to communities and get our clinicians alongside local people in local communities talking about things that are of concern to them, and engaging in communities in a way that's meaningful and has added value. And I think today's event is a really good example of just that, and thank you to Sahel and Tariq and other people that really do put the effort in to bringing people together and arranging for people from healthcare to come and talk tonight is really, really exceptional, and I think they at some point in the proceedings they deserve a round of applause. So I'll perhaps start that now. So we'll just have a quick round of applause for Tariq, Sahel and the team. We're supported again tonight, as we were last time, by Genes for Health at the back there, and I would really encourage you to go over, have a chat, find out what that's about, and get involved. It's a really important piece of research, and we just thank you again for supporting the event tonight. And for Living Well. So Living Well is our local health and wellbeing offer for Rochdale. They are fastidious in turning up at every single event. They're always here, really committed to the work that they do. So again, here tonight, I wanted to talk about cholesterol and I want to talk about blood pressure. So again, if you get the opportunity of a dinner later, please find the time to go and have a chat with the team there. They'd really appreciate it. So to the big events, we've got two speakers this evening. We've got Dr. Ruth Wiggins, who's a respiratory consultant working out of North Manchester General, who's going to talk to you tonight about winter bugs and winter respiratory conditions. And then following Ruth, we have got, where is he? Here we have, we've got Chris Dalton, who's the lead. He's a physiotherapist by trade, but the lead for something we call the Enhanced Respiratory Service in Rochdale. just been recently accredited, so a really highly well regarded service. And Chris and the team, and there's a number of the team in the room this evening, are going to talk to you about long COVID. And maybe make a bit of a plug for some other services that the team offer as well. So that I'm looking forward to that. So I'm going to hand over now to Ruth, who's going to take us through the slide deck and then hopefully some questions and answers, and then on to Chris. Thank you very much.